Courageous Doctors is a newscast about healthcare topics of concern to everyone. From health and safety tips to recall notices and medical news. Here's your host, Dr. Barry Prystowsky.
Hi, this is Barry Prystowsky with Courageous Doctors, the new show for you and your doctor. It's so good to be with you again. As always, we're going to discuss updates on the COVID epidemic, as well as government updates with Obamacare and other regs. Then we'll talk about other general healthcare news of interest and end with health and safety tips and other interesting facts. So let's begin. In terms of COVID, ABC News says that although our number of cases are going down, our death rate is still steady. It's been that way for the entire epidemic for the last 2.5 years. Hospital cases are down. The patients that end up in the hospital aren't necessarily going there because of COVID. They just happen to have COVID while they're there for other reasons. The New York Times said that the CDC now has new regs. We no longer need to test on exposure to COVID or even to quarantine unless, of course, you're sick. And if you're sick, all bets are off. It's the same as usual. Stay home for until there are no symptoms, or if you have no symptoms, maybe give it 5 days, and then you can return with a mask for another 5 days. Reuters says as well there's no need for, now, as you know, it's back to school time, so everybody's interested in what's going to happen. Most schools are going maskless, but check your district. But there's no need, according to the CDC, to test at daycares or schools if you're exposed. Of course, if you're sick, like any other illness, just go home. Let's see, Washington Post informs us that President Biden is now forming a new pandemic office in the Department of Health and Human Service that will be over the Center for Disease Control for Pandemics, and the position is called the Assistant Secretary of Preparedness and Response. Bloomberg News says that most of the people that like we said, even after 5 days, when you feel like you're not sick anymore, a lot of people are still testing positive on retests, but they're just not as contagious. Stat News Show says that brain fog is a major problem, and I've been hearing on a number of documentaries on TV. A lot of people are researching this. We still don't know a lot. We know that it affects as many as 1 in 5. The Oxford University said it can persist for 2 years, and 1/3 of these people can have mood disorders. They're even at higher risk for strokes or even dementia. And anything 6 months after infection, they're starting to consider like the long COVID, we're calling it. MedPage looked at a study from Lancet that looked at 1,700 patients in the Netherlands, trying to define what is long COVID. We're still trying to figure out all the effects of this disease. And they talked about patients with chest pain, difficulty breathing, and this is going on after 6 months, 2 years, muscle pain, loss of taste or smell, tingling in the ears or tingling in extremities, heaviness, a heavy feeling in extremities, a feeling of a lump in your throat, that's really uncomfortable, trouble feeling either hot or cold, feeling dizzy, having headaches, nausea, or fatigue. Now, this is interesting. CNN said that 30% of children who were hospitalized for COVID with the inflammatory, multi-system inflammatory reaction, which is similar to adults with strokes and things, and arrhythmias and things like that, that they also had persistent symptoms even after they left the hospital, with fatigue, shortness of breath, cough, headache, fever, and malaise. But I got to tell you, as a pediatrician, generally what we see in children is they have a much milder case, and except for these few that had the adult-like stroke-like, blood clotting, organ damage that adults with bad COVID get, except for those few that it happened to, most of the kids do really well. But certainly it's something to look for, and they're starting to claim that even kids that had mild COVID still to look for if they have persistent symptoms, but we'll follow the studies and get back to you on that. Let's see. The Lancet, following up on that, this is interesting. Lancet said that children may initially have anxiety and depression, but it's transient after the COVID, but then they can also have the brain fog for up to 2 years. Helio mentioned that they were beginning to see the blood clotting in the lungs, the myocarditis, cardiomyopathies, even in young patients. So we got to really keep our eye open. Healthy Day says that some people are saying after being vaccinated with COVID, that some women were saying it changed their menstrual cycles, and that was published in Science's Advances journal. So we probably should ask our obstetricians about that. Associated Press said that the Pfizer shot has proven to be 73% effective in children less than 5. And that's good. We in the office have begun now since the fall of last year, I guess. Was it last year? Oh, I can't remember, but I think it was. We're injecting the little kids and under 5, or maybe it was more recent. I can't remember. But, just like we have the shot for 12 and older, we have the shot for 5 to 11, and we have the shot for under 5. So we've been giving that, and I'm glad to see it's 73% effective. And good news from Reuters mentioning that the Novavax, which is the traditionally made vaccine, instead of the messenger RNA, new technology that everybody was afraid of because how it causes the chromosomes to start making the spike protein inside your cell, the old shot that doesn't do anything but inject a piece of dead material and have the body react to it. That shot is finally out by Novavax.
Don't go away, there's more courageous doctors after these messages.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we're thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Courageous Doctors continues with Dr. Barry Prystowsky.
Okay, let's move on to other government regulation and Obamacare. Reuters says that this is interesting, the Brooklyn United States District Judge rejects a motion for injunction, the injunction to block medical surprise bill. You know, the medical surprise bill where if a doctor's not on your plan, he can't just surprisingly bill you. Some doctors were against this, and I guess insurance companies that want to get their, I think some doctors that wanted to be paid brought suit, but they said, look, the providers can still find other ways to bill the patients or negotiate something with the insurance company. So the surprise bill definitely is there. It's the law. If you think you're going to a hospital or a doctor that's on your insurance plan, and you know you're going there and it's on your plan, you can't be billed by somebody that's not on your plan. Okay, USA Today the Department of Health said that the stats are 8% of America is still uninsured. So even with Obamacare, it went down from 25%, but there's still a lot of people out there without insurance. Rev Cycle Intelligence said that those people who are covered by their employer's insurance, you have a job and you get health insurance from your job, you are paying 2% more into that from your salary now. It's interesting. NPR said that community groups are receiving grants from the government to sign up patients for health insurance, especially for the 4 million uninsured children. So 8% of America is uninsured, but 4 million of those are children. That's no good. CNN said that the bill that was recently passed, to decrease drug prices, that is only for Medicare, where you'll have, for example, a $35 cap on insulin, because the CMS, Center for Medicare, that's and Medicaid, that's the branch of the government that handles distribution of that insurance. That is now allowed to negotiate prices with this new legislation the president signed. So we hope that this will decrease prices for us, for other people paying private insurance, but right now that's at least the start. And there's just some numbers listed. For example, 150 million people are covered through their employers. They will not be affected by this bill. 14.5 million on Obamacare may not be affected, but the 64 million on Medicare will. Plus those who are disabled and have Medicare, they'll be covered too. Bloomberg covered it by having prices decreased. Bloomberg, Center for Medicare and Medicaid, the CMS has new Medicaid home health benefits for children with medically complex conditions, and that will start soon, October 1st, and will include access to specialists. That's great. I love that. Washington Post says that the World Health Organization has finally declared the global health emergency for monkeypox, and all of us are trying to figure it out. We in the office have been culturing for it with LabCorp, but we haven't found anybody positive, but we know we have hundreds in New Jersey that are positive. Every potential monkeypox case, which is a blistering case. Most of you are familiar with chickenpox or Coxsackie, hand, foot, and mouth. Those are blisters, or if you ever got blisters from poison ivy. So it's a blistering illness like that, similar to the smallpox, which is it's in the smallpox family, the orthopox, but we just haven't found it. Okay, let's move on to other healthcare news. As always, I start with recalls, and my disclaimer at the beginning is remember that I'm giving this news show later after having read all the news, so some of these items may have been removed from your shelves, so I'm mentioning them to you, but the disclaimer is they may be okay and safe again. The bad ones may have been removed from the shelf. So wherever you buy your food or medicine or whatever is recalled, just please check with the people at your store and just make sure it's safe. Okay, we have a few of them. CNN says there's listeria, that's bacteria, food poisoning bacteria, and it's in a certain kind of butter called Epicurean butter. It's a lemon dill butter tubs, lemon dill butter tubs, and they're sold in Wegmans. Sorry about that. E. coli was in the Hawaiian ground beef. That's no good. And Chronobacter, which is the bacteria that shut down the Similac. It was in the baby formula. That's no longer in baby formula. But now they found that same terrible bacteria in King's Hawaiian pretzels, slider buns, and hamburger buns and bites. So Let's see. There was also E. coli recently found in Wendy's in their romaine lettuce. We've had that for years, had that problem. There's sanitizer found in something called wild cherry tapri. I guess that's a little drink you drink with a straw. More Chronobacter was found in Oatly, Stumptown, and Oatly oat milk and coffee. Also infected were pediatric supplements and snacks, but not the baby formula. That's good now. Pediatric supplements and snacks, I'm not sure which ones those were. Thicken liquids, like we use with people that can't swallow. We thicken their liquid. Glucerna, as you know, that's a popular medical energy drink for people that have trouble with food ingestion. Something called Intelligentsia, Aloha, Kate Farms, and Premier Proteins had this Chronobacter. So again, just check and see what's out there. Let's see. This is Ed. You know that erectile drug Cialis for erectile dysfunction, tadalafil. Somebody put it in Tango energy supplements. I don't know how it got there. And one last one. Plastics were found in Purdue gluten-free chicken. Okay. Let's see. Let's go on to other healthcare news. The Star Ledger, as we said, monkeypox is here in New Jersey. It mentions 13 counties. I'm sure it's more than that now. Ars Technica. This is a tough one. Burkholderia, very bad bacteria. It'll kill you, do horrible things to you. Get a load of this. It's in aromatherapy room sprays. I have no idea what that is. Aromatherapy room sprays. It's also in Better Homes and Garden, lavender and chamomile, essential oils aromatherapy. Sounds like a massage. When you go get a massage, you get all that stuff. It's also in room sprays with gemstones. So, I don't know, just check on that. Let's see, Fox and Washington Post both commented on the Vibria, which is a very bad killer bacteria in raw oysters. Somebody died in Florida at a beach resort, at a restaurant. Yeah, if you're down in Florida or even anywhere along the East Coast, just be careful. Make sure everything's washed. If you get a cut and you're in the ocean, make sure that you disinfect it right away. This bacteria can get in through cut skin. You can eat it. You don't want Vibrio. It's a bad one. Washington Post says that West Nile virus is here, and I just read something before coming on air that somebody in New York actually died from it. Let's see. We also want to mention that pre-diabetes is now up in teenagers. Let's see. CNN says that, this is tragic. They commented, the CDC said that a child died of that amoeba, Naegleria. That's that brain-eating amoeba. It gets in through your nose when you're in a lake or river, canal or something. They basically say, look, if you're going to go swimming in something like that, not your regular pools or resorts, nothing like that, not even oceans. I mean, this is where you have stagnant water, a lake, a pond or something. They said, don't kick up the dirt and wear something to put nostrils to protect nostril guards. This thing, if you kick up the dirt, it's in the dirt in the lakes and things, and it gets into your nose and kills you. So it's not worth it. Last thing here was the Lyme disease vaccine. Yes, Lyme disease vaccine is in trial with children now. We're so excited. I know I give my dog a Lyme vaccine. I know horses get it, but thank God we'll finally get one for children. Okay, let's move on to the last section, and we'll be all done. This is a general section with health and safety tips. And I'm going to, it's not too much. Let me start with the Insider magazine. They're reminding us of the melatonin outbreaks, overdose outbreaks. And this in part seems to be due, at least from the studies I read, that it's not always the same. When you get a 1 milligram tablet, like my patients usually start with 1 milligram. By the way, it's usually the younger infants taking it to get to sleep that are overdosing. It's because not the same amount is actually in. Like if they may say 1 milligram, but there might be twice as much in there, and people are overdosing. For example, in California, the Zarbee's Sleep Gummies were supposed to be 1 milligram, but were more than 2. And in Canada, this was the Journal of Clinical Sleep Medicine. There was actually serotonin mixed in somehow, and causing headaches, nausea, agitation, or something of that sort. Anyway, just again check buy your medicine from a regular pharmacist that knows what's in these things. Don't fool around. Fox News, yep, a lot of us are still out there getting some sun, so be careful. Fox News said there was a recall on the banana boat sunscreen. It had benzene. Benzene's a very toxic chemical. At the very least, it's going to burn your skin, and if you inhale it or ingest it, it can damage your organs and poison you. So that was a recall, banana boat sunscreen. The Insider said that, this is incredible, you guys. I don't understand. It amazes me. I see things as a pediatrician every day, and I don't know. I'm still amazed by this stuff. Kids are putting flavored condoms, for the sexual condoms, for protection. They're putting those flavored condoms, soaking them in water to release the polyurethane, and then drinking it and getting a high. Who knows what's going to happen next? Okay, let's move on. The WHO is warning of sugar substitutes. You guys are familiar with sugar substitutes: aspartame, saccharin, sulfame, potassium, something called luo, tanguo, which is monk fruit, neotane, stevia, if you've ever heard of that, sucralose, and avatane. They're just warning that it's a sugar substitute, but if you eat too much, you're going to gain weight on it anyway. And by the way, I thought this was an interesting stat. They're saying men should not have more than 9 teaspoons of sugar a day, 9 teaspoons. That's 3 tablespoons. And women should not have more than 2 teaspoons of sugar. 6 teaspoons of sugar, which is 2 tablespoons. So men, 9 teaspoons or 3 tablespoons. Women, 6 teaspoons or 2 tablespoons. So I guess we have to be careful of our sugar intake. USA Today said don't go out and start drinking rainwater for all those people that stand out in the rain and keep your mouth open, I guess. It is raining down PFAS, those polyurethane, fluoridated, whatever's, all that horrible plastic that we're scared about, we're finding in our water. Somehow it's coming in the rain, so I don't know how. JAMA, our Journal of American Medical Association that I read religiously, it's a very good journal. It follows this and talks about microplastics found in the lungs and blood of patients that were autopsied. It's not really sure how much that's affecting the body, but who wants all that plastic in you? And it mentions a higher incidence of finding these plastics in patients who have diseases like colitis, bronchitis, cancer, thyroid disease, even people that have higher blood fats. I guess these plastics somehow lead to higher blood fat levels. And even though they were banned in baby foods, remember the polyfluoroalkyl, the PFASs were banned in baby foods. They're still used in packaging of foods, so you're still going home with this. I've seen on all the news shows, they're all talking about the packaging of these, using these plastics and PFASs. Okay, let's see. CNN said, this is interesting. You may like this. Homemade baby food, a lot of us try to be natural, organic, homemade. They said the homemade food has just as many toxic metals and as organic and even the organic as food bought in the store. I mean, who would have thought? I thought it. And they say because the food that you're using to make your homemade food is still grown in soil that has lead and arsenic and mercury and cadmium. So if it's in the soil, it's going to be in the food. So I don't know how to protect ourselves. Stay tuned on that. We'll let the experts tell us. But they did mention a few things that may make you feel better. They said the safest foods that have the less of these toxic metals: lead, arsenic, mercury, cadmium. So bananas, good old-fashioned grits, southern grits, baby meats, butternut squash, lamb, apples, pork, eggs, watermelon, green beans, peas, cucumbers, and milk. So they had the less levels of these. They also warned us to use lead-free water in mixing baby formulas, get the lead out. And they said babies were okay with yogurt, applesauce, beans, cheese, hard-boiled eggs, and grapes. But they did recommend not to tease on arrowroot teething crackers or rice biscuits, but rice has arsenic in it. They said better to tease on a frozen banana. So the rice was the worst. Oh, this is interesting. Not all rice is the same. The worst rice for arsenic is found in rice grown in Arkansas, Louisiana, and Texas, and the best rice is in California, India, and Pakistan, and something called sushi rice grown here in the USA. Interesting. Let's see, Southern Living article. The USDA said, United States, Agriculture Department said that for all you people that store your cooked beef in the fridge, they said please keep it wrapped in a plastic wrapper and to put it in the fridge within 2 hours of cooking. And if you're going to eat leftovers, don't eat leftovers that have been in the fridge more than 3 to 4 days. In fact, this seems to be popular. I've been seeing this on quite a few different news shows. Coming to the end soon. Let's see. It's also unsafe to microwave hot dogs unless you're really careful because you have to make sure they're cooked well. Oh, here's one of my favorite people. Toby Amadar has a lot of fun articles. And here's one on energy drinks to remember that caffeine and guarana, they have no calories, so they can't really replace the meal. They might wake you up, but they don't have calories, so you still need to get your protein and sugar elsewhere. Don't drink more than 3 to 4 cups of coffee a day. Tea has less caffeine. Remember, Red Bull has not only caffeine, but also some sugar, vitamins, and taurine, which is an amino acid, which is probably why it wakes you up better. And Bolt 24 from Gatorade uses, this is interesting, watermelon and sea salt. And it uses that stevia leaf extract. Remember we mentioned stevia before as a sugar substitute. So that's why Bolt 24 and Red Bull can actually give you some calorie energy. But coffee has no calories. It's just to wake you up. Healthy eating. I always like fun things like this. It's a fun thing to read. Healthy eating said that eggplants are good for you. They have fiber, manganese, and antioxidants. Berries are good for you, especially raspberries. They are good in fiber, low in sugar, and have antioxidants. Oh, this is interesting. The medical press said that be careful with vegetarian diets. Some of these kids weren't growing well, and you have to add some calcium and protein to them. And lastly, another one of my favorite people, Daniel DeAngelis, talks about how to get protein in your breakfast foods. And most of these have, like for example, there's 15 grams of protein in a cup of broccoli or blueberries or nuts or Greek yogurt. So she just mentions, you've got these things like you can put together avocado, kale in an omelet. You can do nut and berry parfait in a yogurt. You can do spinach and feta cheese with egg. You can do raspberry and peach mango in a smoothie. You can do smoked trout and spinach and eggs, or even peanut butter and banana on cinnamon toast. So I hope you all enjoyed this show. It was fun meeting with you again. As always, I look forward to hearing from you, and any replies we'll mention on our next show. Please enjoy a safe rest of the summer, safely and rested back to school and work, and hope to hear from you all again. Stay tuned.
Courageous Doctors, Pioneers and Heroes. Executive producers Barry S. Prystowsky, MD. And Patrick M. Marucki. Post-production Patrick M. Marucki. Makeup by Lisa McAllister, Salon Jimmy Gerards. Music provided by Videoblocks. Special thanks to American Medical Association and New England Journal of Medicine. Visit us on the internet at courageousdoctors.com.